Alright, so I guess it wasn't good enough for Jeffrey Bezos and Amazon to attempt to monopolize the entirety of the retail industry here in the United States, because apparently they are going to be moving into an entirely different industry, which is somehow even more ghoulish than the everyday business practices of Amazon. So here from David Sirota's outlet Lever News, we got Matthew Cunningham Cook reporting that Amazon is joining the Medicare privatization spree. They say the retail behemoth has acquired One Medical, which is in the Medicare privatization business. So what are they talking about here? They say Amazon, the $1.25 trillion company founded and led by Washington Post owner Jeffrey Bezos, has announced that it is acquiring One Medical, a private equity-backed primary care provider that generates over half of its revenue from a for-profit Medicare program. So I've done coverage in the past, if you want to go check out on my channel, of breaking down this privatization scheme that was put in place under the Trump administration and is now being continued under the Biden administration. But, to say the least, it's absolutely disastrous and is only going to be further undercutting this program that is one of the most popular programs in the history of the country, which, if anything, should be not only decommodified in its entirety, but also expanded to cover the entirety of the American people. But they continue here with more details, saying while Amazon's profits from its core consumer retail business are dwindling in part because of heightened competition from brick and mortar retailers that were shut down at the beginning of COVID-19, the corporation's cloud computing division, Amazon Web Services, continues to enjoy robust profits thanks in part to generous government contracts. And in and of itself, I could make an entire video breaking down how Amazon is absolutely obliterating small businesses in this country because of the types of ways and methods and strategies that they use on their Amazon sales platform, where they basically just steal people's products and pass them off as their own, make slight adjustments, and then prioritize their own products over other retail sellers on their marketplace. So in and of itself, that's a massive problem, as well as their government contracts working alongside the state. A lot of that has to do with some of their web services, cloud computing contracts, as well as their surveillance programs that they have in place. So in and of themselves, both of these things could deserve a video, but they continue here with more details, saying that now Amazon could be attempting to build on that federal largesse by seeking to milk revenue from Medicare, the national health insurance program for seniors and people with disabilities. And they say Amazon, which has broad market power, reach, and influence, could use its new platform to advance the cause of Medicare privatization at a much more aggressive pace. The consequences wouldn't just mean more taxpayer dollars funneled to mega corporations, but also Medicare recipients facing a healthcare system with ever more resources being allocated to profit instead of care. And they say, as the Lever reported in April, President Joe Biden's Center for Medicare and Medicaid Services, CMS, has expanded a Medicare privatization scheme that was launched under President Donald Trump. And that program, which is currently referred to as the ACO REACH program, involuntarily assigns Medicare patients to private health plans operated by for-profit companies like One Medical subsidiary, Iora Health. And they say Medicare provides set payments to provide care for these patients, much like insurance, and this arrangement incentivizes Iora and other privatization entities to limit the amount of care that seniors are receiving. So you understand the fundamental flaws of having the profit motive dictate an inelastic market like healthcare, right? You have actual patients like seniors and people with disabilities, some of the most vulnerable people in terms of healthcare in this country, and all of this company's business model, all it is at the end of the day is just being a completely unnecessary middleman between the patient and the care that they are getting from a doctor. And in the process of that, because they are operating for profit, they have a direct financial incentive to reduce the amount that they are giving to those patients in terms of healthcare, because they're getting those set payments from Medicare services. So they're directly financially incentivized and in fact profit from denying seniors and people with disability healthcare that they deserve. Okay, so pretty much the most, ghoulish and absurd business model you could possibly ask for, but, just another glimpse into what late stage capitalism has to offer us. But they continue here saying continued expansion of Medicare privatization seems integral to One Medical's business model. And they say the company's most recent quarterly report shows that more than half of its revenue comes from Medicare. This includes Medicare Advantage plans operated by private health insurers, traditional Medicare fee for service payments, and the ACO REACH program. So again, just basically being completely unnecessary unnecessary leeches on our healthcare system here in the United States. But finally, they continue here saying, like many mergers, both parties in Amazon's new acquisition benefit from the arrangement. Amazon gets a more stable revenue source just as its retail segment is faltering, while One Medical gets Amazon and Bezos considerable political power, and that power has led Congress to seriously consider granting Bezos a $10 billion subsidy for his Blue Origin space exploration boondoggle, just riding his private dick rocket off into space. We're going to give him $10 billion to do that, as if he doesn't have infinite funding and capital and resources to do it himself. But they say it's also led Senate Majority Leader Chuck Schumer to stall on holding a vote, vote on bipartisan antitrust legislation being championed by Senator Amy Klobuchar. Surprising that she's leading that charge, but nonetheless being held up there by Chuck Schumer. And they say Amazon has a suite of powerful lobbyists at its disposal, including the lobbying firm run by the brother of Steve Ricchetti, who is a counselor to the president. The tech giant is the 8th highest spender on lobbying in the country this year, according to data collected by Open Secrets. So obvious conflicts of interest there within the Biden administration, nothing surprising, but, this is part of the reason why we can't actually get solid antitrust legislation. There's no leadership from the top. There's no willingness to confront the power that corporations like Amazon have within our economy and within our political system. So, that's the, corruption baked in within the U.S. government. But finally here we got a statement from the Congressional Progressive Caucus and Pramila Jayapal, who said the ACO REACH program is a Medicare privatization hidden in layers of bureaucracy. Essentially, seniors are put into this program, which allows a profit-seeking third party like a health insurer or a private equity-backed firm to step in and get paid by Medicare to manage the care that they get, taking for themselves the profit that is whatever they don't want to spend on the patient. So again, obviously there's a lot to say about Amazon just as an entity, as a capitalist enterprise with the power that they have, increasing market consolidation in the retail sector, but that's been something that's been going on for a while now. Again, they also have their Amazon Web Services, which works directly with the government in a multitude of different ways, as well as their business model just at a fundamental level, relying on squeezing out lower level or smaller businesses and smaller retailers who have their products on Amazon, which puts them in basically an impossible position, because if you want to sell things online, you basically have to go through Amazon if you want to get a wide reach. But then you have a corporation like Amazon that's going to look at the success or potential success of your product, and then they're just going to make one themselves and undercut you on the price because they can afford to, because of their infinite resources as a $1.25 trillion company. They're going to undercut your price, prioritize their products at the top of their websites, and crush you and destroy your small business. So there's those aspects of it. But now we have Amazon, again, not only trying to monopolize the retail sector, but also trying to monopolize, or at least get their foot in the door in the medical sector. And again, the company that they are purchasing here, One Medical, their entire fucking business model relies on denying people healthcare. I mean, that's the same as any other private for-profit health insurance company. None of these companies need to exist. Their entire existence is wildly unnecessary and, disturbing, honestly, in a healthcare system. Because if the goal of a healthcare system should be, at least in my opinion, I think most people would agree with this, the goal of a healthcare system should be to provide universal access to healthcare for every single person, regardless of how much money you have in your wallet. But these private for-profit health insurance companies, including the one that Amazon is attempting to acquire here, their entire business model just relies on denying people care as much as physically possible, so that they can extract as much money out of these government services, or by putting people into massive amounts of debt. So keep in mind, we are literally the only developed country on the planet that allows this type of privatization, that allows this type of profit seeking within our healthcare system. This is not normal. This is not acceptable. It's absolutely disgusting. And of course, the Biden administration, like on many other things, we talked about the foreign policy following exactly in Trump's footsteps. Same, it appears to be here with healthcare. Still no word on that public option that Biden was running on in the 2020 primary that he said would be so easy to get passed through a bipartisan way in Congress. Still no word on the public option. Still no word on Medicare for all. Certainly not. But still, we're pushing forward with the Trump policies on privatizing one of the most popular and long-standing programs in the United States with Medicare services. So, in terms of how they could possibly prevent this, you need to have regulators step in and say that, it's obviously not acceptable for a giant monopoly like Amazon to keep acquiring businesses like this. You could have, the federal government step in and block this type of transaction, but I have my doubts given the wild conflicts of interest that exist between Amazon and our leadership within the Democratic Party that that's going to happen. So I'll keep you guys updated in terms of how this ends up playing out. But just another example in terms of why we need a Medicare for all, single-payer healthcare system as soon as possible, and to move away from these types of privatization schemes that do absolutely nothing but reduce the amount and the quality of care that people in the United States are able to get.